Welcome to Inside Marywood Health Sciences, where it's all about real voices, real stories, real Marywood. I'm your host, Samantha Miko, and today we're taking a deep dive into a department grounded in advocacy and compassion, social work. Joining me is Kaitlin Anderle and Yerodin Lucas. Welcome and congratulations on your new positions within the department of this semester. Can you tell us a little bit about your titles and some of your expectations for them?
Absolutely. So, like Sammy said, my name's Kaitlin, and I am now serving as the director and chair of the School of Social Work, but I will also be continuing in my role as the BSW program director. My hope is to continue to bring my vision forward in regards to advancing the Bachelor of Social Work program and having that be a clear path to the Master of Social Work program. And really, I guess the biggest part of my vision is really bringing together both the bachelor's and social work, bachelor's and master's programs, making sure that we are working together, that we are one unit, and that
one school of social work.
Yeah, that we're one school of social work, that we are collaborating together, and that we're also connecting the students at both levels as well, that we're able to have the bachelor students learn from the master students and allow the master students to be more so a bit of a mentor to the bachelor's level students. That's something that I would really like to see for the program.
That's great. How about you, Yerodin?
Yeah, I'm Yerodin Lucas, and I am the director of the Master's in Social Work program in the School of Social Work, also an assistant professor. And, some of my hopes and expectations, just kind of echoing a little bit of what Kaitlin talked about, is bridging some of those gaps between the BSW and the MSW program. When I say that, thinking about how do we help students at the BSW level when they want to advance to the MSW, what are some of the questions that they may have, making sure we bridge those kinds of gaps, making sure that they have an understanding of what the rigor of a master's program will be. Also, a good chunk of my role will be working with faculty, helping with faculty development, helping faculty achieve some of the things that they want and goals that they've set for themselves, both short-term and long-term, and also looking at the creation of new courses. And, one of the things that I recently learned at a CSWE conference is that social work as a field is really behind the eight ball when it comes to artificial intelligence. And so making sure that we're getting ahead of that. And so our students are understanding, and not just the students, but our faculty and staff are becoming more tech savvy and understanding the changing and evolving needs of students and the actual profession itself.
That's great. I can't wait to see everything in the next few semesters of what you guys are going to be able to accomplish. But first, let's talk about a little bit of your past. How did you get here? Was there something that inspired you to go into social work? I know a lot of people in the health sciences have something happen to them at a younger stage that pushes them towards this career. What about you guys?
I'll go first.
Sure. For me, for those who may not know, I come from a K through 12 background. I taught 5th through 8th grade middle school in Philadelphia for about 9 years, 7 as a teacher, 2 or 3 as an administrator. And during that time, I got to work with social workers and, working with the families and the students that we were, working with in our area, in our community. Never thought I'd be a social worker. I didn't think that it would, lead to this. But then when I moved into higher ed and in my previous position, a lot of the work that I was doing with social work, didn't realize it until people who were in the social work field, who were mentors of mine, sort of guided my thought to that process. I will honestly say that and I'll probably repeat this again, but I had a very narrow view of social work because I really only saw it at the micro level, like, individual one-on-one type things. But, now having gone through the program and being a faculty member in the school, I see how the breadth and depth of social work as a profession. So what led me here, honestly, I think it was just organically. It made sense.
Nice.
So, yeah.
How about you, Kaitlin?
So I think a lot of things brought me to social work in regards to my family upbringing and struggles that my family had and that I had personally, especially in high school. And so I knew that I wanted to be in a helping profession, and I wound up being a little bit of Same thing as Yerodin in terms of thinking that social work was a lot more narrow than it is. I thought I had a really clear vision of what it was, but I really just had that micro focus. And I also had this idea that I think a lot of students have in regards to, oh, I want to help people. I want to help people. And that is a great reason to come to social work. But what has really kept me so engaged in social work and growing in social work is the idea of we are not here to do for people. We are here to do with and help them learn how to do for themselves and empower them to know that they are capable of doing these things for themselves and that they might just need some assistance. We're here to walk the journey with them, and we're not here to tell them what the path is. So I think that while my path brought me to social work very early, I was someone who I didn't change my major. I came in with social work when I came into Marywood and did my bachelor's degree. But in terms of what has kept me so passionate about it is the fact that it's about helping people help themselves.
That's great. And you both discussed and said one of the words that I was going to discuss, micro. So I know that we say there's a lot of misconceptions with this profession. Does it start on the micro level and then there's the meso and macro? Can you guys explain a little bit about what those words mean in your profession?
Well, I don't think it starts at any particular point of those three tiers. I think it's more of the type of social worker that you want to be and the populations that you want to work with, or for example, thinking about micro, as I mentioned before, I think about that as like that one-on-one connection that you're making, like you're working with a family, you're working with, a particular population at that micro level. So for example, a population needs a certain amount of resources and you're helping them navigate how to get those resources, whether it's home security, food security, like things like that. But then when you look at the macro level, you're sort of thinking this from like a maybe 15-20,000 foot view of what you're encompassing more people. So macro level would be like policy development, policy creation, working with a government, working with a think tank, United Nations, that kind of thing. And then the meso level is that you're looking at organizations. It's more of an intermediate level. So you're looking at organizations that focus on like groups, organizations, communities, and you're looking to address like a shared concern between those particular entities. Yeah.
That's a great way to put it. I personally didn't know that much about social work because I'm part of that population that doesn't know a lot of the things, and I myself, I'm sure I have misunderstanding of the profession. Are there anything else that you guys think that students coming in need to know that is a misunderstanding that would help them decide that, yeah, I want to be a social worker?
I think that there's a lot of misunderstanding with social work, and it's something that I actually address in one of my first classes with freshmen or students who have transferred into Marywood or who have actually changed their major to social work, is really helping them to understand what does it mean to be a social worker, and that social workers, I firmly believe, belong in all places, and that we are trained to be able to think in a systems perspective, that we're able to think about things through not just looking at the individual, but looking at the individual in their environment. And we also borrow from a lot of different professions. So we borrow from psychology, from sociology, from counseling. We take all these different ideas and then we look at, okay, how are those different systems impacting the day-to-day life of a person? And I think that students often just think about that one-on-one. They might have had a social worker that they saw for counseling, but also one of the biggest misconceptions is that we only work with children, that we work in child protective services or with children and youth. And so students knowing that there's a world beyond that, and that actually a lot of people don't work in that area of social work, and that we work with people from beginning to end of life at all stages for all different reasons, and just at overall being able to improve their life. So whatever that looks like, anyone can improve their life. Everyone's going to hopefully be working towards improving their life. So we can work with people at any stage for any reason. And it just depends on what that is. And I think that they don't know that there's a lot of different settings that they can go into, that there are social workers. I got to work in the hospital, in the emergency room. So we've had a lot of students who change from medical fields that maybe they're not as interested in the medical part of it in terms of being able to learn the science end of it, but they're interested in working with people and they want to be in that medical setting, that interdisciplinary setting. And so they can then go into work in medical social work and be able to be in these environments and make change and maybe do it in a way that's more meaningful for them and what they're hoping to do.
And I think just to be quite frank, another misunderstanding is that there's this belief that social workers don't make any money. And so that's not something that students hearing that would incentivize them to go into the field. But I will say that is a misconception and a misunderstanding, because it's about, it could be, agencies that you work with. It could be whatever level you're going at. There's also, I said this in one of our recent symposiums that we had. Like, social workers are known for their side hustles and things that they do, in addition to, like, for us, we teach full time, but we do other things like, we can be clinicians, we can see, and also one of the things that Kaitlin said a minute ago that I truly agree with is that social workers belong everywhere at every table. And in fact, your comment just made me think about they're having a economic summit in Switzerland now, and like a lot of the major countries are there, and the Prime Minister of Canada, Mark Carney, said, if you're not at the table, then you're on the menu. And that really stuck out to me. It was just like, okay, we need to be at the table. So, yeah.
Hi, I'm Professor Dalton from Respiratory Therapy, reminding you to inhale confidence and exhale stress.
So with any major in any department, we start in the classroom. Can you guys discuss a little bit about the courses that you guys offer and what a social worker will be learning inside the classroom?
Absolutely. So talking about the classes is definitely probably my favorite part. I think that the really amazing thing is that we touch on all areas and we give an overview to students and help them to understand how to work with all different kinds of groups. And so whether that's or all different levels. So we have, our intro classes that talk about foundations of social work, talk about contemporary social work, where in the first semester of their first year in social work, they're going out into the field and visiting agencies and getting to see what is it like to be a social worker. They're getting to meet with different social workers who are running these agencies in our community, who are graduates from our program, which is just so incredible for them to see that they started in the same exact place as them and that they're there now running the agencies that they hear about on a almost daily basis of places that people can go for assistance. So they're getting to go and see, okay, what is it like to be a social worker in these different settings, and getting to have a more clear understanding of what does that actually mean. They're getting to learn all the different services that exist. We also bring in different kinds of speakers so they can learn about things that maybe places they wouldn't be able to visit, such as a prison. So we can't bring them into the prison at this point, but we can bring in social workers who work in corrections and who are working within the prison system. So they're getting to do things like that. They are also getting to take classes on research and policy, and then getting to take those introductory level different kinds of knowledge and apply that to, okay, what does this mean on a larger scale? And then we kind of do that looking at the different levels, the zooming in, zooming out, and getting to look at the individual and family and what are the skills that need to happen in order to work with those folks, to working with neighborhoods, communities, and organizations, and getting to do what we call a community change project, and trying to see, ideally connecting their junior field placement, which is about a 50-hour placement where it's a little bit more shadowing, but they're getting a larger sense of what does this actually look like on a more day-to-day basis to be in an agency, preparing them for their 450-hour placement their senior year. And so ideally, they're identifying where there might be a gap in that agency and then coming up with a project for, okay, how can I help to address that gap? How do I make sure that I'm not just assuming what needs are and that I'm actually talking to people who are maybe experiencing that need, talking to people who work there, not just going in and assuming that they are the expert, coming in as the observer and as someone who is trying to learn and understand. And so they're doing different kinds of projects where they might be collecting. There was a need at a local agency, Friends of the Poor Catherine McCauley Center, for period products. And a student learned about period poverty, and that was something that is not addressed and that we don't have a lot of donations for. And so they were able to collect quite a bit of money, over $300, to put towards getting period products for that. And that's something that then they have the period project, and then that's provided to local schools. So just seeing the students see a gap in one area and then address it. And then we do a lot of different kinds of hands-on experiences as much as we can. So we do a class on groups, and that's probably one of my favorite classes. We have students, they have to pick a evidence-based practice. They work with a partner, and they have to learn about this evidence-based practice. And so with an evidence-based practice, we're really looking at, okay, what is going to be the best practice? What is the science behind it? What is actually something that we've seen that has data to back using this intervention with people? So they're getting to learn about that. They're presenting with their partner. They're really starting to contextualize what is it like to work with a certain population using this evidence-based practice. And by the end of the semester, they are taking all of these different skills of working with groups. They're taking this knowledge of this evidence-based practice that they've focused on and now taught their peers about through a presentation. And then they are doing a co-facilitation with their partner of this evidence-based practice. And every student gets they give their classmates different roles. And so they have to all do a role play together where they're taking on these different roles within the group. So really putting themselves in people's shoes, getting to really practice that empathy. And they are then facilitating that using the different skills that they've learned and the different interventions within that evidence-based practice. And it is so cool to see the students all get really into it. They all are so nervous that, oh, well, what if my peers don't take this seriously? They all take it so seriously. And I've actually been moved to tears watching it and seeing students who maybe have been more quiet in the classroom come into their own and find their voice. It's really beautiful. So that's one of my favorite things that we do. And we just try to do projects that really help them to actually get out there into the community, or take things and bring them to the classrooms and have them try to start practicing. So this way, the first time that they're experiencing something isn't when they're sitting in front of a client. So those are some of the things that we try to do.
Which is great. I mean, you touched on how they're balancing theory, practice, self-reflection, and so much more in what they're 4 to 6 years. How many years is a social work program?
There's a advanced standing program actually for the bachelor's level where students can actually gain master's level credits. So some of these classes that I was just referring to, such as the individuals and families, the communities class and the groups class, those are classes that as long as they attain a certain grade, then they're able to get graduate credits for that too. So they could potentially finish their master's in 5 years. Whereas otherwise, a student going full-time, they would need to do 2 years.
2 years.
So this cuts off an entire year of their program, and then they're able to enter the field sooner. And obviously, it's a cost saving measure as well. So that's a big positive.
Sure, always great things. Yeah. Less time, less money, helping people even earlier in the world. And, we've discussed a lot of great projects and a lot of great ways of the community. Another thing that I know that happens at this university is the symposium. Can you tell me a little bit about that?
Sure. So we have a fall symposium and a spring symposium. And also I want to mention that happens not only at our Scranton campus, but also at the Lehigh Valley campus in Allentown. And so that's a time where students are, we invite students, faculty. We also invite our field directors and all the folks related to field. And so This year, especially like it's been done in past years, we're going to have 2 keynote speakers. There's a theme that we've developed, and the theme is talking about immigration and global justice. And so our speakers are going to speak to that, and our students are going to get to work with. We always do like a sort of like a case study breakout where students get to work with faculty on solving a real world issue, and then we debrief about it. And so students get field hours for that, but also it's continuing education credits for the professionals who are there. And so it's something that's done every year, like I said, every semester. And I've only been in the department for 2 years, but I know that it's been going on for years.
Yeah, it's been going on. I had the opportunity to not just now teach here, but I've been at every level in terms of being in the bachelor's program, being in the master's program, working as a staff member, and now being a faculty member. So it's something that has gone on for many years. And I think that we get to really highlight our different field placements and the different field opportunities that we have for students, where we bring people who are supervising our students on a daily basis at different agencies to this. And when we do these different breakout groups of case studies, then we're actually able to see that kind of collaboration between agencies and students. And sometimes they're freshmen and then they end up doing their internship there. So it's a really great way to have the students learn to network from a really early stage in the program.
And it's also a huge way for them to apply what they're learning in the classroom.
This break is brought to you by the Speech Language and Audiology Clinics, helping you hear it, say it, and mean it.
Okay, so we talked a lot about the field placements and the courses. Can you tell me what kinds of field placements exactly the Marywood students are experiencing, and maybe how they match, or do students choose? How does that process work?
Well, I'll talk a little bit about how they're selected. Kaitlin, you could talk a little bit about the actual placements themselves. So we have a field director, Dr. Michelle Ostrowski, and we also have a field director for the BSW program, Elizabeth
Brunix Paris.
Yes, I was going to mess that up, so thank you. And from what I've come to understand about the field program is that students work with the field directors at both levels to choose where they like to be placed. We also have what I know some programs don't have, and I know in the past we didn't have it, but we have also employer-based field. So students, if they're working at a particular agency or organization that meets the accreditation standards, they can do their field, which is huge for some, because there's quite a bit of hours that students have to do for field. And so they work with the respective field directors to choose a placement that's not only falls in line with what they want, but also their interest. We don't really want to say you have to work here, you have to work there. These are the options that are available. You can make a choice here, or is there another one or another place that you know of that might fit? Let's talk. And then we can come up with an MOU with that particular place. And, we can, even for example, there was a shortage at the master's level. There were students who wanted to work at the elementary school level, or K through 12. And we didn't necessarily have a lot of locations that fit that. So there was, me working in the field, I was able to contact some of the other schools in the local area and some of the suburban areas. And now we have those particular, Michelle has worked with, and I know Elizabeth has also, I believe, worked with certain school districts to bring those particular options to our students as well.
Do you think students gravitate towards a certain placement more than others?
I do think that actually the schools is a large one that they gravitate towards, because that's something that everyone has experienced. They've all been to school, and oftentimes whether they had a social worker there who made a large impact on them in a positive way, or it could be the opposite, that they want to be that person that maybe there wasn't for them, that they wish that there was a social worker there to be their advocate and to make sure that they were receiving the services that they needed. So I think that we see that a lot, and that because students have that lived experience of attending school, that sometimes they are able to get us, that's where they see themselves. I will say that we've had students who end up going to those field placements and they realize that, wow, this isn't for me. And I think that's a really important component of field, is that helping students to see what they do and don't want to do, where their strengths lie, helping them figure that out through their classwork and through the years of us working together. So this way, them finding out what areas do I maybe not enjoy as much, because that's sometimes just as important, if not more important, than knowing what they do enjoy. So that's part of the process as well. Sometimes when a student says to me, I really, this 50-hour placement, like this is not what I thought that it was going to be. This is where I thought I was going to spend my whole career.
Mm-hmm.
Well, we'd rather them find that out now
Mm-hmm.
than to find that out afterwards when they're in a job and they're out there representing Marywood and themselves. And so we want them to know, this is what I bring to the table, and I see myself at these different kinds of tables, and maybe my classmates I see at those other types of tables.
And also with that, if they're in the advanced standing program, they would have credit for 2 of the 4 field placements, but they still have to do 2. But if you're coming not in just a regular program, you would do 4 field placements over your time in the program. And so a lot of folks that I've talked to think that once they choose a field placement, they have to stick with it for the duration, and that's not true. They can, each semester, if they wanted to, they could choose a different field placement. So, and that's unique in a lot of ways, and I think beneficial for the reasons that Kaitlin just mentioned.
We also have some emerging partnerships with our local federal court system and just the overall justice system that we're really excited about, and for students to have different kinds of opportunities, corrections, and just seeing the similarities and the importance of bringing not just criminal justice but also social work to that lens to
the prison. Are you talking about the prison reentry?
Yeah.
So a lot. Yeah. So Kaitlin's talking about some of the partnerships that we are in negotiations with things like Care Court and the STRIVE program, which are programs that are designed to work with the prison population and helping with reentry programs and having different types of resources available to folks in that population. And what does that mean? And also helping so a lot of the percentage of them don't feel like they have to return back to prison for security, that they can actually find that, once they've done their debt to society and things like that. So, yeah.
Hi, this commercial break in podcast is brought to you by Dean Yeager. Just a reminder, do hard things.
Okay, to sort of wrap things up, we're going to discuss maybe some advice you have as faculty members for the future PACER, the future social worker. What is some advice you have for them entering this field?
I think for me, advice I would give, if you don't already, try to develop a thick skin. There's going to be a lot that you have to deal with, a lot that you have to navigate, and thick skin is really helpful. Also, definitely practice cultural humility. You're going to be working as a social worker. You should pray that you're working with people from all walks of life, because that's going to make you a better social worker, and it's going to help you as you move forward working with different clients, different organizations, whatever level you're at. And also just be aware of yourself, your body, your energy, because all of that transfers to people that if you're having a great day, people are going to know that. If you're not having a great day, people are going to know that. We all have bad days, we all have great days, but just know, do a lot of self-reflection when you can. And also the last piece I would say is have people who are in the profession and also outside of the profession who you can vent to.
Those are some great things to think about. Another thing that's great to think about is just why you should choose Marywood altogether. From a Marywood grad yourself, why should you choose Marywood?
Something that I realized when I began working at Marywood was that the care that exists for all students was beyond me. So when I was a student, I thought, wow, I must be really special that I have all of these people who are here and helping me, and I don't know what I did to deserve all of this support. And that people wanted to know my story. They wanted to know my why. They really kept me going on the days that I felt like I couldn't, and they believed in me. And I think that it was quite a humbling experience for me when I came in as a staff member, and learned that, oh, we take this approach with all our students. We care about all our students to this degree. So it was important for me to know that I wasn't just special, and that actually there's as much help as you're willing to accept. And also that part of the really beautiful thing about Marywood is that when I maybe would lose hope in my purpose or in my path, that I had a lot of people who were the holders of hope for me. And so now I just told a student this past week that was saying, I just don't know how I'm going to be able to continue this. And I told her, that's okay. You don't have hope right now, but I can hold that for you. I can hold that for you for right now. And when you're ready to take that, know that I'm here and I'm holding that for you. And I believe in you. And that is something that I'm so humbled that I get to offer, because it's something that I received time and time again as a student at Marywood.
That's a beautiful thing to say. I mean, I think any student that hears that would jump at the chance to be part of the social work department because of the two of you, really. So I'm glad to have you now in your new roles and your new department roles, and I can't wait to see what you guys do. But do not go anywhere. We're going to do a rapid fire round. Quick questions, no overthinking. First answer that comes to both of your minds. Okay? You ready?
Okay.
Yep.
Coffee or tea?
Coffee.
Nice. Micro or macro?
Macro.
Micro.
Go-to snack during finals?
Fruit snacks.
Pretzels.
Theory or practice?
Practice.
Both.
You can't do that.
A Zoom or in-person session?
In person.
In person.
Field placement or coursework?
Teach coursework, but field placement. Field is the heart of social work education.
I agree. Yeah, field placement.
All right. Now, not so spicy hot takes. Okay. Best class to take in the major?
Research.
He's biased.
That's what I teach.
Favorite class? Do you have a favorite, Kaitlin?
I love teaching the groups class.
How about an overrated buzzword that's in your field right now?
Trigger.
Yeah,
The word trigger.
I think we and hear me out with this. I think we say self-care a lot, but people don't do it.
Yes.
And I wish they would. So I'm not saying we need to get rid of it, but I think we need to give it some traction.
Great. And then the last one, what is the best TV show, movie, pop culture that represents a social worker? Or worst? You might have more that are worse than best.
No, I have one that comes to mind. When you asked the question, it's the first one that popped in my mind. Did you want to?
No, you go.
It's a Netflix series called Made. And
That was mine.
okay. Well, and for those who may not know, it's a show about a TV series about a young mother. She has a daughter. She was in an abusive relationship with her boyfriend or husband, I can't remember. And she's trying to forge a life with her daughter outside of that, and having to, all the things that you talk about, resources, you talk about, things that we think about with a single parent, single mom especially, and all the things that she has to navigate. So, and the social workers that help her do it.
I have my students watch that in my Foundations of Social Work class.
Okay.
So, and because we see in that show, not just the what we want to see in the social work field, but also some of the stereotypes that unfortunately there is some reality to, in terms of people who are burnt out, and having students see the difference between how you show up and the importance of relationships when it comes to working with people.
I love that there's more and more representation of different departments in our health sciences, and I hope that the representation could be better and better for social workers in the future. So thank you guys so much for joining me today and sharing your passion for teaching and your dedication to our students. And thank you to our listeners for tuning in to another episode of Inside Marywood Health Sciences. Real voices, real stories, real Marywood. Be sure to subscribe so you don't miss future episodes. And if you enjoyed today's conversation, share it with a friend or a future pacer. To learn more about the College of Health Sciences, visit marywood.edu/health sciences or follow us on Instagram at MarywoodCHS. Until next time, I'm Samantha Miko, and this has been Inside Marywood Health Sciences.